The subscapularis muscle. The subscapularis muscle lies on the anterior side of the scapula and is sandwiched between the rib cage and the scapula. Here are the landmarks for the subscapularis. We have the anterior aspect of the scapula, the humerus, and the glenohumeral or shoulder joint. The subscapularis originates on the inside or anterior surface of the scapula and inserts on the lesser tubercle of the humerus. Contraction of the subscapularis muscle produces medial rotation of the upper arm at the shoulder joint. The teres major, pectoralis major, and latissimus dorsi all assist the subscapularis in medial rotation of the upper arm, whereas the infraspinatus and teres minor oppose the subscapularis during medial rotation of the upper arm. Clinical findings for the subscapularis muscle. Dr. Travell refers to this muscle as the frozen shoulder muscle. Your clients will typically complain of pain in the posterior shoulder and upper arm regions, and rarely they can complain of pain and tenderness in a very unique strap-like pattern around the wrist. They will complain of pain at rest and in motion. They have an inability to reach across their chest to the opposite armpit, and elevating their arm at 45 degrees is extremely painful. Activating and perpetuating factors for the subscapularis trigger point include swimming, forceful overhead lifting, reaching back at shoulder level to brace themselves for a fall, a tear of the joint capsule in the shoulder itself, prolonged immobilization of the shoulder, and a slumped, rounded shoulder posture. Trigger points in the infraspinatus, supraspinatus, and pectoralis major muscles are all associated with trigger points in the subscapularis muscle. Clients with active trigger points in the subscapularis muscle are commonly misdiagnosed with frozen shoulder, rotator cuff tears, adhesive capsulitis, C7 radiculopathy, and thoracic outlet syndrome.